Hi everyone, we're continuing on with our tour of the cranial bones of the skull. Now we're going to cover the temporal bone. On the multicolored skull, the temporal bone is this brown bone. This is the temporal bone on the plain skull. As mentioned before, the temporal bones are paired bones. There is one temporal bone on the left side of the skull, and there is another temporal bone on the right side of the skull. Now let's look at the temporal bone in isolation. This is a temporal bone that was taken from another multicolored skull. This is the anterior aspect of the temporal bone. This is the posterior aspect of the temporal bone. This is the superior aspect of the temporal bone. And then this is the inferior aspect of the temporal bone. This right here is the squamous part of the temporal bone. This is a sensible name because squamous means flat. This is the flat, vertically oriented part of the temporal bone. Projecting anteriorly is this bridge-like projection called the zygomatic process. This structure is called the zygomatic process because it connects to the zygomatic bone. And then this is the zygomatic bone in yellow. So this is our zygomatic process of our temporal bone, and then this is our zygomatic bone. Posterior to the zygomatic process is a shallow depression known as the mandibular fossa. Fossa means shallow depression, and the mandibular refers to the fact that the mandible, or the jawbone, articulates with the temporal bone here. This is your mandible. As you can see, this part of the mandible, known as the condylar process, fits snugly within the mandibular fossa. This joint that's formed by the articulation of the mandible with the temporal bone is called the temporal mandibular joint, often abbreviated as the TMJ. Here you can see the TMJ on the plain skull. Posterior to the mandibular fossa is the external acoustic meatus. Meatus means passageway. This passageway leads to the middle ear cavity. The external acoustic meatus and the middle ear cavity are separated by the tympanic membrane, also known as your eardrum. Just to make sure you memorize this term accurately, I advise you to stop the video and write out external acoustic meatus 20 times in a row. Okay, so posterior to the external acoustic meatus is the mastoid process. The mastoid process is responsible for the hard bump behind your ear. Inferior to the external acoustic meatus is the styloid process. The root word in styloid is stylus. Stylus means writing utensil, like a pen. This process is shaped like a pen. A muscle that helps you swallow attaches here. Now let's look at the part of the temporal bone that makes up part of the cranial floor cavity. This rocky part of the temporal bone is known as the Petrous part. Petrous means rock. Here you can see the Petrous part of the temporal bone from the cranial cavity of the plain bone, or the plain skull rather. And then here you can see the Petrous part from the base of the plain skull. The Petrous part of the temporal bone houses both the middle and inner ear cavities. You will learn about these cavities during a later part of the anatomy and physiology course sequence. Now, there are two important passageways associated with the temporal bone, the carotid canal and the jugular foramen. This is the opening of the carotid canal as seen from within the cranial cavity. And then this is the opening of the carotid canal as seen from the base of the skull. Again, on the plain skull, this is the opening of the carotid canal as seen from the cranial cavity. And then this is the opening of the carotid canal as seen from the base of the skull. The internal carotid artery, all right, is an artery that travels through this carotid canal. Its job is to deliver blood to the brain. The jugular foramen can best be seen by looking at the full skull model. This is the jugular foramen seen from within the cranial cavity. And then this is the jugular foramen as seen from the base of the skull. As you can see, the jugular foramen occurs at the junction between the temporal bone and this other large bone. This other large bone is your occipital bone. It makes up the posterior aspect of the skull. The blood vessel that travels through the jugular foramen is called your internal jugular vein. See you soon.